I'm Danielle, your host of the Abridged to Motherhood podcast, the place where moms like you learn to thrive, not just survive through pregnancy, birth, and postpartum. I'm a birth and postpartum doula and a mom of two who's been where you are. My first pregnancy was filled with so much excitement, but it was also marked by stress, anxiety, and fear of the unknown. I thought I had everything mapped out, but when postpartum hit, I realized how unprepared I was for the physical, emotional, and mental toll of motherhood. It was overwhelming, lonely, and nothing like I imagined. When I found out I was pregnant again, I knew I needed to approach things differently. I made it my mission to not only prepare for postpartum, but to prioritize myself in the process. That shift changed everything. Now I'm here to help you do the same. Whether you're navigating your first pregnancy, feeling buried under endless advice, or struggling to figure out what you actually need for postpartum, this podcast is your safe space. You'll find practical tips, honest conversations, and expert insights to help you feel informed, supported, and empowered through every stage of motherhood. If you're ready to feel confident, prepared, and truly supported in your motherhood journey, stick around. This is for you. Hey friends, welcome back to the Abridged Motherhood podcast. I'm so excited for you to listen to my conversation with Hannah today. We talk about VBACs and C-sections, but our conversation was just so empowering for moms to listen to no matter what type of birth you're having. She offers so much wisdom and guidance in preparing for birth and in advocacy and what that really means and looks like. I think there can be a misconception surrounding advocacy, and she really kind of pokes holes at that, gives us the tools we need to advocate for ourselves, and so much of it can be applied to postpartum as well. And you'll hear that in our conversation, just where I talk about how it reminds me of our mindset surrounding postpartum and advocating for ourselves and our babies. I really encourage you to give this episode a listen, even if you're not going for a VBAC or haven't experienced a C-section. I think it's just a really powerful episode. So let me tell you a little bit about her. She lives in central Indiana with her husband and kids. She's a passionate childbirth educator and doula specializing in VBAC support and education. After experiencing both a C-section and a VBAC herself, she is dedicated to empowering women to take control of their birth experiences. Through her courses and coaching, Hannah provides tools, resources, and support to help women confidently prepare for an empowered VBAC. She also works with doulas to build confidence and skills in supporting VBAC clients. Hannah is committed to advocating for and spreading awareness about VBAC and the prevention of unnecessary C-sections. She was pregnant actually with her third baby when we recorded this episode. She has since had her baby. She's on a little maternity leave right now. So after you listen to this episode, go give her a follow, show her some love. We all know how precious that time is. And without further ado, here's my interview with Hannah. Thanks so much for coming on, Hannah. I am so excited to just chat about all things VBAC and C-section. I know how important it is. So many of my clients that I work with are facing either healing from C-sections or wanting a VBAC. So what led you to becoming a doula and then specializing in VBAC and C-sections?
Yeah, so like many doulas, my own birth experience led me to that path. However, I became a childbirth educator first. So after my first birth, it was an unplanned, very traumatic C-section for me. And I still work a full-time job. So I was just thinking, okay, I feel like my birth class that I took, which was through the hospital, of course, did not prepare me for birth the way I wanted to. It didn't prepare me for the outcome of a C-section. So I really want to become a childbirth educator so I can create my own birth class that really prepares moms for any sort of birth outcome so they feel prepared for an unmedicated hospital birth or a planned C-section. And that's really what got me into birth work in general. And then after that, after the birth of my second, which was a VBAC, and I had a doula for that birth, and I did not for my first, I was thinking, okay, I'm going to become a doula as well to support not only via education, but also support clients in person. So that's how I got into birth work. And just because of my own experiences, I decided to specialize in VBAC and C-section. And I also felt like there was just a kind of a gap in that education. There was a bunch of regular childbirth education classes, but nothing that was really focusing a lot on VBAC and C-section, and really not C-section. There were some out there for VBAC, but not really many for C-section support. So that's what got me into the work. And like I mentioned, I still do work a regular full-time job. So I've transferred. I only supported in-person clients for about a year, and then it became way too much to juggle everything at once. So I do mainly childbirth education and doula training. So.
I think you are spot on with what you're saying about not being prepared for those extenuating circumstances. And I kind of take that role with the postpartum side of things because there's just a very narrow lens of what we're preparing moms for birth, and even postpartum is less, I think. And so taking that approach to say, yes, of course, we hope that things go according to plan, but if they don't, this is how you can be prepared walking into a C-section, I think is so important for mamas out there and for their mental health too. But as we're talking, I was thinking as someone might be listening who maybe has never heard of a VBAC, can you explain exactly what that is and why they might consider that after having a C-section?
Yeah, so a VBAC is a vaginal birth after cesarean. So it's after you have one or multiple C-sections, you have a vaginal birth for the next. And not many, the VBAC rates are actually pretty low on the amount of people that are actually choosing to VBAC after having a C-section. So repeat C-section rates are actually very high. And that could be by choice or an attempt at a VBAC that ends in a C-section. One reason someone might want to consider that is obviously you avoid a major surgery, and the recovery generally is going to be easier recovering from a vaginal birth versus a surgery. So a lot of people, I feel like the primary reason that VBAC is chosen is I have another child at home or multiple children at home that I need to take care of. I don't want to be recovering from a surgery while trying to do that. Another reason is that if someone was to have many children, if they want to have a lot of children, the risks of multiple repeat C-sections increase with each C-section. So risks for things like placental problems, risks of just surgery in general. Hysterectomy risk goes up with every single C-section you have. So if you want to have a large family, generally VBAC is going to be the best route. And the hard part is that oftentimes it's difficult to find a provider, depending on where you are, who's going to support VBAC. Not just VBAC after one C-section, but VBAC after multiple C-sections. So it's really kind of depends on your personal situation on whether you choose to have a VBAC or a repeat C-section. But in general, if you want to avoid major surgery, avoid a longer recovery, or have a lot of children, or maybe you had a very negative C-section experience and you don't want to experience that again, that would be an option to choose VBAC.
So, what are some key steps that moms can take in preparation for a VBAC? And like you were saying, if it doesn't work out, even a first-time mom with a C-section, what are some talk through preparation with us because I know this is what you're passionate about as a childbirth educator too.
Yeah, so after a C-section, if you know, you may not even know that you want to be back yet, but first just really process your birth experience. That's the biggest thing you can do, especially if it was traumatic. You may not realize immediately postpartum that it was a traumatic experience until you really sit down and process it. So that's the first thing I always recommend to anyone, whether you're wanting to have a VBAC or even if you're going to have a repeat C-section, just process and sit with and reflect on your birth experience and try to heal from that, especially if trauma was involved, especially if you ended up with PTSD or some sort of postpartum depression or anxiety. Process that, go to therapy if you need to, whatever that looks like for your healing. And you don't have to be completely healed and processed prior to getting pregnant again, but at least start that process because trauma is not just in the mind. The body holds on to that as well, and it can greatly impact future births, whether VBAC or repeat C-section. So that's the first step. And then the second would be researching VBAC policies wherever you're located. So even before you're pregnant, even before you're trying to conceive, start researching where you would like to give birth. Are you going to want to give birth at a hospital, a birth center, or home? Look at your state's policies. Maybe birth centers don't support VBACs in your area, and start looking for a provider. Some people just stay with the provider they had for their C-section, and that is good for them. Maybe that provider is very supportive. Other times that provider may not be supportive. So look for multiple locations that you may want to birth, interview multiple providers, and start looking for that support ahead of time versus when you're 5 months pregnant. So I would say those are the first two like biggest steps is finding that support team and processing the birth experience that you just had.
And speaking of that emotional weight that you're carrying, I mean, as someone that's had a VBAC and been through that experience, what's some advice you would give to other moms as they begin to process those feelings and prepare for their next birth?
I would remind people that your next pregnancy and birth are a completely different experience. Just because your first one played out a certain way doesn't mean your next one will also play out a certain way. And that can be really hard to go through, especially like if you end up with similar scenarios in your next pregnancy and birth. So, say you had a breech baby the first time, and that's why you ended up with a C-section, and then your second baby is breech, and just trying to process all of that and work through that. So, like the biggest thing would be remembering that it's a different experience, but also you can plan and prepare for both scenarios this time around if you didn't the first time. Some people did. Some people may have prepared for that C-section the first time around, but oftentimes you don't. You don't go in thinking like this is going to end up in a C-section. So preparing for both outcomes and realizing that it's not the outcome that creates an empowering birth experience. It's the fact that you were prepared, you were educated, you were respected, you had autonomy, you advocated for yourself. So, really preparing to be empowered and make empowered and informed decisions for both scenarios can really help if it does end up in another C-section for you to still feel empowered and like your birth went in a positive way.
I love that. I teach my clients that all the time about preparing for those scenarios because it allows your mind to then think about that possibility and you aren't as surprised if
Hmm.
things don't go that way. And I think mentally down the road, that can be really helpful in processing.
Yeah.
So if we do end up in a C-section, whether it's a first baby or we're going for a VBAC, how do you help parents prepare for that possibility with that confidence and peace of mind? I mean, you talked a lot about feeling empowered and advocacy, but what specifically, what suggestions do you have for moms in preparing for a C-section potentially?
So the first is like when you're creating your birth plan, make one for vaginal and C-section and make it very explicit on different options that you want. So whether you end up in an unplanned or a scheduled C-section, you can still have a plan and preferences for what you would like. So I always suggest that they take each scenario. So, okay, say a vaginal birth needs to turn into a C-section for some reason. If it's unplanned, and not scheduled, here's what I would like. I would like, obviously, if it's an emergency, like a crash C-section, there's going to be a lot different circumstances. So think about the different types of C-sections that you could potentially be
Hmm.
having. And if you want your partner there, if you want your doula there, if you want music playing, if you want a clear or a lowered drape, skin to skin, and breastfeeding in the OR, like think about all of those different options that could occur and what your preferences would be for them. And then not just like the first best case scenario, but okay, if this is not available, then what do I want? And it's the same way for a vaginal birth too. So, okay, I'm planning to go unmedicated. If for some reason I'm not coping well, here's the first round of pain control that I would like. Here's the next, whatever that may be. So think about scenarios A, B, C, D, E, F, G, and all the different things that could happen.
Hmm.
And not saying that those things will absolutely be possible and happen, but at least you are aware of what can happen. At least you are aware of your options and you feel empowered ahead of time to think about and make those decisions versus when you're stressed in the moment, like, oh, what do I want right now? So even in an emergency situation, you can semi prepare for what's going to be happening and give your birth team that communication way in advance. Like in your first or second trimester, have those
Hmm.
conversations often and frequently and discuss them with your providers, with your nurses, with your partner, especially your partner, whoever's going to be there supporting you, so they are able to discuss and advocate on your behalf if needed. There are situations where you may not be in the mindset to do so, so they need to be fully educated on not just what you want, but how to advocate for that as well.
And that's exactly what I wanted to talk about next was your partner's role. So how can your partner support a mom through that VBAC prep or during a C-section birth?
The first thing really is that we often know, like, we've all been through this. We're usually the ones educating ourselves, listening to the podcast, reading the books, doing all the things. Involve your partner, whoever is going to be there with you in that process, whether you have a doula or not, whether it's your mom, your sister, your husband, whoever it is that's going to be with you, involve them in that process. Don't just make sure they know the information, make sure they know why it's important to you and the reasoning behind it. One of the questions, like, for example, that my husband had was like, he didn't know what a VBAC was. He didn't like understand it. So he didn't really understand the reasoning behind why I wanted that. So I really had to make that clear to him. But he also didn't know like that some people just think you should have another C-section. So he didn't really have information either way. So I'll just give them the factual, tangible information, really make sure they understand why you're wanting what you're wanting. Because if they understand that on a deep personal level, they're more likely to advocate and stand up for you in a way that's more personal than just like, yeah, she doesn't want an epidural, but they don't really understand the reasoning why. And then giving them the language to use. Because some people, even ourselves, knowing the language to use in those certain situations, it's not just as easy as people always say, like, no is a full sentence. Yes, it's a full sentence, but it's not always as just easy as just saying no,
Hmm.
especially in the moment. So just knowing the actual language to use, the words to use to advocate for yourself, and the reasoning behind that can be very, very helpful, even just in your prenatal appointments, because then especially if your partner's not with you, you're one-on-one with the provider and it may feel like awkward, like you can't like speak up. So practicing all of that ahead of time can be really helpful, almost like role playing, which can feel really awkward. Like, why am I practicing saying these things? But if you practice them more, you'll be able to say them better in the moment.
It is. It's nerve-wracking to speak up to a provider when this is their job and what they've been doing for X number of years and what they do every single day. You walking in saying, I disagree with you or I want something different than what you're suggesting can feel very overwhelming. And I know, at least for me, it took a while to be able to get to that place for me to be able to advocate for myself.
And people think that advocacy and like choosing something like means arguing or like yelling or being mean or confrontational. And it doesn't have to be that way. Half the time, like your provider and nurses are just not gonna, they're like, okay, whatever. They'll give their recommendations and that's fine. And it doesn't mean you have to like yell at them or be mean to them or that they're not gonna like you. You can express and advocate in a way that makes it clear and they'll just document that. Most providers generally are not going to be like screaming at you to agree with them. It's okay if you disagree with them. That's just their opinion.
Exactly. And if they are screaming at you, you can ask for a new
Yes.
provider. And I feel like sometimes women don't know that that is an option. You know, you can ask for a new nurse, you could ask for a new provider if you're really in a situation that is not going well for you and preparing your partner to be able to do that as well for you is really important. We talked about researching a provider earlier, and I'm just thinking about, you were talking about your birth team with the nurses and the doctors and your partner and maybe a doula or your mom. What should women look for when they are creating that support team?
I would say it's going to depend first on like where you're choosing to give birth. So obviously if you're birthing at home, your birth team could look much differently than it would in the hospital or birth center. So you could have your cousins, like you can have as many people as you want or as little or as few people as you want at your birth at home. But if you're going to be in the hospital, it's going to look differently. You're obviously going to have hospital staff there, providers there, but don't just think of your birth team as people within the hospital, like your provider and the nurses. There's a lot more to it than that. It's any family member, friend that you choose to have there with you. And I do want to make this note that every person you invite into your birth is an intervention. Their energy is an intervention. Their presence is an intervention. What they do is an intervention. So just think about that before you just invite your aunts and uncles to your birth. Think about, so your friends, family members, whoever you want there, if you want a doula or however that may look, the provider you're having, and make sure you know based on your birth location, like, is it going to be my provider that I've seen my whole pregnancy? Is it going to be whoever's on call? Know that there could be different options in that. And also know that the majority of the time, the person that's going to be with you the most is going to be your nurse if you're in the hospital. The provider usually just kind of shows up at the last minute to catch the baby, unless there's complications. And then also, like, your birth prep team. So that could be like chiropractors, pelvic floor therapist, regular therapist, massage therapist, like anyone who is preparing your mind, body, mental state, energy for birth, and then the people that are going to be there present with you at the same time. So there's so many different options for who you could have on your birth team, and it can seem overwhelming. It's not always just who is there with you at the present time of birth.
That's a really good point about all the people that you're working with during pregnancy too, because seeing, for example, a chiropractor who doesn't believe in VBACs, that can mess with your head walking
Hmm.
into birth. We really have to think about things like that too, because our minds can be easily influenced, and even what we're watching on social media too. I think
Hmm.
about that a lot. So that's a really good point to think through all of those things as a mom. I want to talk a little bit more about that advocacy piece. I just feel like it's so important. So I know you talked a little bit about role playing. Could you maybe walk through some phrases or some suggestions for moms on how she can advocate, whether that's in labor or during her appointments with her provider of how to address her wishes moving forward?
Yeah, so I'll give some like specific examples. I'll give like an overarching like general example and then I'll give like specific examples. So the first is, so say provider is recommending XYZ intervention that you do not want at this time. So you could say something along the lines of, I understand your recommendation and I appreciate what you're saying. At this time, I do not want XYZ, but I'm open to talking about it later. Or at this time, I want to try this first and then do that later. And so here's like a specific example. If they say an epidural is required for all my VBAC patients, which is actually way more common than someone might think. A lot of OBs say epidural is required in case of an emergency. They don't have to be put under general anesthesia for a C-section. So you could say something like, I understand that that is your policy and what you recommend. I would really like to try and attempt my VBAC without an epidural and remain unmedicated. If it comes to the point where an epidural is needed, I'm open to discussing that. Or you can just flat out say, I am choosing to birth unmedicated for this VBAC. That is my plan. If I need to be under general anesthesia or something for my C-section, I am okay with that. So just acknowledging what they're recommending you is the first thing instead of just saying, like, you're wrong. I don't agree with you. Like, I'm not doing that. I mean, you can say that if you want, but just acknowledging, like, I understand your recommendation and this is what I'm choosing at this time. A lot of providers will push back. So, one thing you can say if you want to just make it very clear is like, I do not want that at this time. Please document that in my chart because they're documenting your refusal at that time, your informed refusal, not just your just willy-nilly, I'm refusing this. Ask them to please document that in your chart or document that in the notes. That is what I'm choosing at this time. Another thing is, like, say you are in a prenatal appointment and they're trying to discuss or make a decision or something that you don't feel like you can make at that time and you need to think about it or reflect on it. Like, for example, I don't know, GBS swabbing or testing or something like that, or a growth scan because baby looks like it might be big or something like that. You can say, I don't feel comfortable. I need to like think about that right now. Can we discuss that at my next appointment? I need to, I'm going to talk to my husband about it. I want to talk to whoever about it. I don't feel like I can make a decision on that right now. I would like to discuss that at my next appointment, please. So you don't have to make a decision in the moment, especially at prenatal. Obviously, in birth, you probably need to make a decision in the moment. But at a prenatal appointment, you don't feel like you're pressured to make a decision and consent to something right then and there. So it's really a lot of people think that like what you need to say is very complicated, but it's just like any other way in your life. Like when you're talking to someone and you don't want to do something, like I don't really want to do that right now, and you don't have to justify that decision. Just communicate it. You don't have to argue. You don't have to yell. You don't have to justify. Just communicate it like you would to anyone else. Just because they're your doctor, they're your provider, and they have authority, doesn't mean you can't just communicate to them like a normal person.
That's a really good point. Just how you would talk to your partner or your mom or even your kids
Yeah.
a little bit of, no, that's not what we're going to do right now, but I'm open to discussing it later. And I like what you said about acknowledging that you've heard them. I mean, that's just communication 101
Hmm.
is making sure that both parties feel heard and understood. So, great suggestions for moms to use and advocating for themselves. And as moms are listening and maybe they're feeling nervous or uncertain about what's possible in their next birth, what encouragement or wisdom would you share with mamas to leave them with?
I would just let them know that you do have options in the type of birth you're wanting, whether that be a VBAC, a repeat C-section, at home, at a birth center, at a hospital. There are options available, even though in a lot of locations, a lot of states, a lot of cities, it can feel very limiting. Every state is going to be a little bit different. But knowing that you do have options, but also understand what you're wanting and why you're wanting it. Remember that core deep why of the type of birth you're desiring, because that can really help you stay motivated throughout the process. It can be very discouraging, especially if you feel like your provider's not supportive and or your partner's not supportive and they're scared about VBAC or they don't want you to do XYZ. Remembering your core why of what you want can really be helpful, especially if it's about certain interventions. So, say you don't want an epidural. Well, why don't you want an epidural? Make sure you understand that why, because that's going to keep you motivated throughout the process. And then researching those options that you have way ahead of time can be very, very helpful.
And that why is so powerful in postpartum too. And thinking about like if you want to nurse for 12 months and on the hard days, what is that going to look like? Or if you are feeling like you want to really take care of your body postpartum, why? And
Mhm.
coming back to that over and over again. And that's such a good, powerful advice for mothers in all areas of our lives, really.
Especially at like the end of pregnancy when you're just
Mm,
exhausted and
yes.
uncomfortable and you're just like, I want this baby out of me now. Like, I don't care how it comes out, I want it out. Just remembering, okay, why did I want this birth experience in the first place? Why did I
Hmm.
want to decline elective induction at 39 weeks in the first place? Just remember your why, especially towards the end when things are just feeling like I'm going to be pregnant forever and my provider doesn't support me. Like, is any of this
Hmm.
even worth it? Because those feelings of exhaustion and pushback, and they're all temporary and it'll be over soon. So just remembering that why is so important.
It's all temporary. It's all a season, right?
Hmm.
So for my listeners who especially are wanting a VBAC, talk to them about where they can find you. And I know you have a course specifically for parents too, to walk them through this.
Yeah, so my website is thehannahgill.com. On Instagram and Facebook, I'm the Hannah Gill at the Hannah Gill. And my podcast is called Motherhood Flow, and it primarily focuses on VBAC and cesarean, but there are a lot of general motherhood topics on there as well, different expert interviews. And I have a training program for doulas as well as a VBAC prep program for parents called VBAC is Your Birthright. It more so focuses on low intervention hospital VBAC, but a lot of the the approaches and things can be used for home birth VBAC, birth center VBAC as well. A lot of it is that mental healing and preparation and really getting that mindset right, not just a bunch of statistics and information about VBAC. So there's a lot of inner work in that program, but I feel like it's very important to do all of that, especially if your first birth may have been traumatic or difficult and you just feel like you really need to process that to move forward to a VBAC. And that is, again, that's called VBAC is Your Birthright, is that program.
Thank you so much for your time, Hannah. I really appreciate it. And go give her a follow and give her podcast a listen, guys.
Thank you so much for having me. I appreciate it.
Thanks so much for tuning in to the A Bridge to Motherhood podcast. I'm so glad you were here today. If you loved this episode, I'd be so grateful if you could leave a review for the podcast on whatever platform you're listening on. Share it with a friend or snap a screenshot and tag me on social media. If you decide to leave me a review, go to abridgetomotherhood.com/review. That link is also in the show notes so that I can send you a little gift in the mail. Your support helps other moms to find the podcast, and it truly means the world to me. Remember, your motherhood journey deserves your care and attention. Until next time, keep showing up for yourself, mama, and don't worry, I'm here to help every step of the way. See you soon.